Hi, today I'm going to be talking about the importance of equine therapy and why it should be covered by insurance. What equine therapy is. According to CRC Health, equine assisted therapy, also called hippotherapy, is a form of therapy that involves professionals and interactions between patients and horses. Insurance currently do not provide coverage for equine therapy. If insurance were to cover equine therapy, there is a lot more benefits that patients would be receiving from this and possibly be able to gain more from their therapy. There are a lot of benefits that come with equine assisted therapy. Benefits such as patients become more assertive, emotional awareness, they would learn how to be more empathetic. It also helps teach stress tolerance, communication, flexibility, impulse control. It majorly helps with mobility, especially of the legs and back, depending on how the therapy is done during each session. For some people with back problems, they might have them stretch out back across the rump of the horse. With people with mobility issues in their hips and legs, just having their legs around the horse helps a lot. For some people with cerebral palsy, they might have them just with no saddle so that the warmth of the horse's body can help with the muscles. It also helps with problem-solving skills and independence. These are just a few of the benefits of equine-assisted therapy. There's really a lot. It also works for many different conditions: ADD, ADHD, PTSD, depression, social anxiety. Other therapies and insurance. Insurance covers a lot of other types of therapies. They cover physical therapy, mental counseling, medicational therapy. They cover occupational therapy, but they still don't cover equine-assisted therapy. When these forms of therapy don't help other people, equine-assisted therapy can be used to help in conjunction with other therapies. Medications. Many psychiatrists and doctors will push medications when they feel like mental counseling isn't working or physical therapy isn't working. They push pain medications, Xanax, Valium, just to try and help these people. A lot of times when someone works with horses or animals in general, those medications can be cut back and occasionally cut out. For my high school senior project, I actually did it on the benefits of hippotherapy. I volunteered at CBC Equine in Elk Grove, California, and I worked with disabled children and adults, primarily children. Every day I would go in and we would help kids handling the horses. They would walk the horses, they would ride the horses. We would help them. It helps them learn, and then in the riding process, they start gaining confidence, and when they gain confidence in one area, they tend to gain confidence in other areas. I saw it work a lot for kids with cerebral palsy. I saw it work for kids that had emotional disorders. I saw them become more flexible, more mobile, more confident in general. I watched them develop better communication skills and better problem-solving skills. They became more independent and wanting to do things on their own, wanting to brush a horse rather than having someone hold their hand and brush it with them. There is a lot of success with equine-assisted therapy. According to Northern Clinics of Istanbul, 2 young women exposed to sexual assault during childhood were observed in hippotherapy. There were also conditions causing serious motor limitation, coordination disorders, conspicuous muscle spasms, and postural disorders. So people with multiple sclerosis or cerebral palsy, depression, just many different disorders. In watching these 2 women undergo 20 separate sessions, each lasting 30 minutes, They observed postural improvements of 30%. They also observed coordination improvement of 80%, balance, sociality, and self-confidence improved of 50%. I read a book by Naomi Scott. It was called Special Needs, Special Horses. She told several different stories about successful sessions of hippotherapy with mostly kids. Two of them that really stuck out to me was one story by, her name was Leah. She suffered an intrauterine stroke. After a year of hippotherapy sessions, they noticed that her balance had improved. It allowed her to compete in horse shows, and it was something that she couldn't have been able to do without the therapy. She also had much improved confidence. Another story that stuck out was this child named Brandon with cerebral palsy. At first, he couldn't stand on his own. After approximately 6 months, he had more relaxation in his legs, giving him more mobility and more stability. He was more able to move around. It helped him emotionally, and it helped with his self-esteem, and he was actually able to avoid surgery, which they thought would be imminent for him. He had also complained of less pain. For me personally, I feel like it could help with my anxiety. I also have a family member who has cerebral palsy. When I lived in Nevada, I used to give him lessons on the horses that I had. I noticed that he was able to use his legs more. He put more weight on his left leg. He tends to walk on his toes a lot. He started doing that a lot less. He walked more flat. He started using his hands more. He was less emotionally frustrated because he was more capable. When we moved away, he was no longer able to continue this because as their family can't afford it. But if insurance had covered it and still did cover it, then he would be able to continue those therapies and probably be progressing more in life. In conclusion, equine-assisted therapy, also called hippotherapy, has many benefits for many different conditions and disorders. Hippotherapy, with all of its benefits, is just as effective and sometimes even more so effective than other therapies. It can be used in conjunction with other therapies and actually tends to be more beneficial when used in conjunction. There are many, many successful stories, such as Leah's and Brandon's, and either my youngest brother-in-law, how he was successful when he was able to continue the therapy with me. These are the reasons that I believe insurance companies should cover equine-assisted therapy and provide for patients something that could be more beneficial than just one or than medications on their own. And these are my works cited.